Maria Cid Medina is in San Jose with a KPIX 5 original report.
I was actually the first nurse who had a COVID patient.
Mawata Kamara took care of San Leandro Hospital's first COVID-positive patient.
There was no real process. We had to call the state at the time, and then the state told us that she has a low probability. And then because she had a low probability, we had to send this patient home. We were not prepared. And it was distressing as a nurse.
Both Mawata and Catherine Kennedy, a registered nurse more than 100 miles away at the Kaiser Hospital in Roseville, say they tried to warn staff to prepare for the pandemic, including hiring and training more nurses.
What is the preparation? What is the plan?
We saw how many people were dying in other countries. Why did we feel that we were going to be immune to that experience?
But when patient after patient began showing up and testing positive for COVID-19, both say their hospitals failed to protect them.
The PPEs were locked up, and we had to deal with N95 versus no N95. Are we reusing them? I've been a nurse since 2008. I know I've never, ever heard about reusing PPE.
They were never meant to be used and reused, because years ago you reuse something, you were disciplined for something like that. Now all of a sudden it's okay.
Catherine, the president of the California Nurses Association and part of the National Nurses Organizing Committee, claims in some hospitals PPE is still not readily available.
It's exhausting making sure you have what you need. Not having to look around and say, hey, manager, I need this, instead of having it readily available for you. And it's important for the administration, the hospital industry to understand that our lives matter.
Now, just as dangerous, the registered nurses say they're dealing with a severe shortage in staffing.
We have one nurse doing the jobs of 3 people. That's dangerous. That's dangerous. One person should not be doing the jobs of 3 people. Every day I get these calls about picking up more hours. And then I've been in many conversations where nurses just don't want to do it anymore. We don't want to do it. It's too much.
Nurses are getting frustrated to the point where they may do their 2 or 3 shifts per week and no more. And no more. And there are those that are deciding to retire early.
So far, according to a database created by journalists at The Guardian, COVID has claimed the lives of 3,607 healthcare workers. Now the nurses fear working conditions may only get worse as COVID cases climb and nurses tire from the toll of the pandemic.
And we feel like hospitals should have done better to prepare. We're the ones who's taking the hit for it, while they're calling us heroes.
Making the employer understand that we don't want to be heroes. We want to be able to go home to our families, to our community.
Mawata says they're having to put people in hallways once again, and there are talks about opening up more rooms to deal with the surge. This time there is a shortage of nurses and the patients more combative.
We are seeing an increase in volatile behavior, whether it's the patient or the visitors.
While both RNs say they respect a patient's decision not to get vaccinated, they say they know deaths can be prevented.
And I trust science. And even though people in your neighborhood may be telling you something different, what I'm seeing at the hospital is different. I've seen, younger people who thought they would be okay and went out and came back and gave it to their grandma. And now their grandma is dying.
Both nurses say they want to get a handle on this virus, but they know they can't do it alone.
It breaks my heart that we've gotten to the point where there's so much distrust in healthcare.
Both Kaiser and San Leandro Hospital released statements acknowledging the work of healthcare workers in the last year and a half and say they've provided them resources, including mental health services. Specifically, San Leandro Hospital acknowledged the shortage of PPE in the beginning of the pandemic, as well as the current shortage of nurses nationwide. In San Jose, Maria Cid Medina, KPIX 5.